Hi, I'm David Nappi, and I'm a physical therapist in an outpatient hospital in Virginia. This video covers my experience preoperatively for the modified Brostrom with internal brace procedure. If you're interested in following my progress or would like to learn more information on rehab and recovery, please like and subscribe to my channel. This is a medical disclaimer, but this information is my personal experience with this procedure, following this direction and protocol of my orthopedic surgeon. In addition to my professional experience as a physical therapist, it is not intended to direct you in any way following your surgical procedure or post-operative care. It is important to follow the direction of your surgeon and post-op care team for your specific situation, including weight bearing precautions, range of motion, and strength progressions for your specific post-op protocol. So a brief history of my injury that prompted the surgery was that 12 years ago, I was playing intramural flag football. And after catching the ball, I pivoted to the right while my legs stayed on the ground as the defender came into me. My foot inverted. I heard and felt a loud pop. There was a lot of swelling for about 2 weeks, but then afterwards, I was able to manage it conservatively. Swelling went down and pain went away. The ankle, however, remained feeling as if it was unstable and loose after all of this. Over the following years, I continued to sprain my ankle about 1 to 2 times per year. But overall was able to rehab it through just strength training, balance training, stability training exercises. My last sprain, though, happened about last year in January when I was playing tennis. I was going backwards, my foot and ankle were planted, and so it kind of rolled out over it. And again, didn't hear a loud pop, but it resulted in a significant amount of pain. Following this, I just wasn't able to really get over the hump of that dull, persistent pain on the outside of my ankle. Whenever I pivoted, I could feel my joint shifting out of place just a little bit. If I pushed myself too hard, I could feel a sharp pain in the outside of my ankle that carried over into the next day. I followed up with ortho this time just because I tried to rehab it for about several months, but wasn't really able to do that. So after consulting with my orthopedic surgeon, I decided to proceed with the procedure, the modified Brostrom with internal brace. Now, a bit about this procedure is that the Brostrom surgery has been around for over 50 years. It's been modified and enhanced to really target instability at the ankle. And so the main target of the Brostrom procedure is to restore that stability through reconstructing and reinforcing the two primary stabilizing ligaments of the outer ankle, which is the ATFL and the CFL. Both of these ligaments are really critical in passively stabilizing the ankle. And once they're really injured, it can result in, like I said, a lot of instability. So when my injury occurred, I really was trying to avoid a lot of excessive movements because of just the pain. But I still really wanted to participate in a lot of the activities I wanted to do: jogging, running, playing tennis, doing intermittent intramural sports, a lot of different activities that just were affected by my inability to really stabilize my ankle. Normally, you also have muscle structures that can help to stabilize the ankle, but I was trying this for about several months, whereas before I was able to stabilize it, things were good, I was able to recover. Back in January when it happened, several months later, I just wasn't able to really get back that function, even with strengthening the outside of my ankle. So when you have an ankle sprain, the likelihood of recurrent sprains is pretty high. And so that repetitive trauma to those ligaments can result in them just becoming weaker and weaker over time, to the point where they're just really not functioning the way they need to provide the stability you need for the activities you want to do. So that's in this case, I sprained multiple times, again, had multiple injuries to my ankle, and by the time I sprained it in January, it just was a struggle for it to come back, and it just wasn't able to recover. When they do the Brostrom procedure, it's either arthroscopic or open, depending on the surgeon and the technique they use. Regardless, is that most of the Brostrom procedures are fairly consistent with each other in terms of they're always working on restoring stability of the lateral ankle ligaments. The thing about it is that everyone's situation is a little bit different. So when you go into the procedure, They're also going to look at the musculature, primarily the peroneals. They'll look at the bone to see if it's inflamed or if there's any spurring. They're going to look at the capsule. They're going to look at all these other different structures to see if there's anything else they need to really work on. And with my case, the ligaments were the only thing that were really an issue through the MRI. Outside of that, I didn't really have any bone spurring. I didn't really have any muscle injury. Didn't have any other issues that they really had to address in the surgery. So with regards to the postoperative protocol, it'll be different based on how many structures that they really addressed. You can think of it as the more complex an issue, the more it takes to resolve. Same thing with orthopedic surgery. The more issues that are underlying that they have to fix, the more complex the surgery, and subsequently the more issues that, not issues, but the more they have to actually address. And so the recovery for that can actually be a little bit longer than, depending on how much they have to work on. So going into preoperatively, I knew I wanted to have the surgery back in November. And the time frame from selecting surgery as an option and when the surgery was actually going to be performed was about 6 weeks initially. It actually got pushed back. My surgical date got pushed back to February 2nd. So when I talk about the preoperative time frame, I had a lot of time to really strengthen my ankle. It is actually pretty important to work on strengthening your ankle. It's important to strengthen your leg, to improve your core strength, all because you can imagine surgery as trauma. When you have an injury, there's already underlying damage to, really, in this case, the ankle. And so surgery is going to go in there aggressively through incisions, through drilling, through anchoring to create stability. Those processes are inherently traumatic for those tissues that they're addressing. So it's actually very important to go into it as strong as you can and as mobile as you can, just because you're improving the resiliency of those tissues to the traumatic stress of the surgery. When you have that time before operation like I did, there's a few things that you want to kind of consider. Is you want to have, like I said, a pre-op plan. You want to be able to have, again, the strength. So you want to kind of start off with an exercise program. I know it may be a little bit painful. I know for me it was pretty painful when I was doing exercises. But I managed it through not pushing myself too aggressively, just trying to get as much motion as I can with what I had. Same thing with strength. I knew that gradually the muscles would get weaker and deconditioned after surgery because you're not really supposed to weight bear for about 4 to 6 weeks. Sometimes it's a little bit earlier where they get you weight bearing, but regardless, is that your muscles are going to get really, really weak after surgery. And so preoperatively, I needed to work on building strength. So I did a number of different exercises. You'll be able to kind of see some of the exercises I did in other videos I'm going to post. And then increasing mobility. The other thing you want to try to do preoperatively is to prepare your environment. Can't stress that enough. Prepare that environment that you're going to be returning to after surgery, which is usually your home. It could be a neighbor's house, a friend's house. It could be you living with your parents for a little bit while you're non-weight bearing and struggling to move around. But that environment that you're going to be in is going to be pretty consistent for about 4 to 6 weeks. So when you go into that surgery, you're going in usually able to walk in 2 legs. When you leave that surgery, you're going out unable to walk on one, and you only have one leg to walk on. So it's really one of those situations where you have to train your body to compensate in a way, because you're trying to protect the surgery site to allow it to heal, but also you're trying to avoid further injury. So it's actually important to adapt your environment so that those aspects of compensation are a little bit easier. What I mean by that is, you want to have good mobility devices. You want to make sure the mobility devices you're using are comfortable for you, so they're not adding additional stress, so that you're not breaking down other areas. You want to have good swelling control, just because the early part of postoperative care usually results in a significant amount of swelling. Again, you're damaging those tissues. Normally, the tissues have to swell up in order to recover, but excessive swelling can cause those tissues to take longer to recover. The muscles can be drenched in essentially fluid, and so those muscles around the area can be very, very inadequate and dysfunctional when you have that much fluid staying there over a long period of time. Same thing with the blood vessels, same thing with the nerves, same thing with the healing tissues and the ligaments that we just repaired. So swelling control is actually very, very important for that early post-operative care. For me, I bought a number of different items to help with mobility and swelling control. These are kind of the items I'll kind of walk you through, but the first item I really bought was the ice machine. The ice machine itself can be very helpful because, again, you're depending on which ones you have. The one I bought has a wrap that goes around the foot, and so when you fill up the ice machine, this bucket with cold water, ice water, it goes into a pump that gets sent to the ankle, and when that pump gets that fluid, cold water to the ankle, it also adds compression. So it's kind of like a dual effect. You get the ice to help reduce the activity of the ankle so that the swelling can be a little bit more minimized, but you also get the compression, which helps to stimulate a pumping effect on that ankle fluid to get it pushed back up so that it goes away from the ankle. So that's one of the first investments I bought. And the second one I bought was actually a leg pillow. So I knew I was going to have to sleep with my leg elevated. Again, swelling can upset enough that it's actually very important to get that swelling under control early on. It'll help a lot with that post-operative pain control, but also it'll help a lot with post-operative recovery and hopefully get you further down the line quicker. So I bought a leg pillow to help elevate my leg while I was sleeping. Normally you could just use a number of different pillows and just, stack them on top of each other so that you can elevate them, the leg. And that's normally sufficient for most purposes, but for me, I just decided to buy a pillow. Why not? The third one I decided to buy is actually, people don't necessarily think of this, but when you shower, early on you're going to have a cast, you'll have a boot, whatnot. You're not supposed to get that wet. You're not supposed to get the incision drenched and immersed in water. And so you really want to have something to protect the foot and ankle in that cast, boot, splint. And what I bought was an actual cast cover. You can find these on Amazon. Again, I'll post a link to a lot of the things that I bought. I'm not sponsored by any of these companies. I'm just giving my professional opinion on what has worked for me. And it makes it a whole lot easier to be able to put that on and not have to worry about my cast getting wet. Normally, you could also tape a plastic bag. I've seen and had patients who have done trash bags, one of those paint plastic covers from Lowe's, seen those get cut up and then again taped to the lower leg. The thing about those is that, I'm a hairy guy on my lower leg, so when I have tape on top of plastic and then I'm ripping it off after a shower, it makes me not really want to shower many times, and I like to shower. So that really was not really an option for me. Honestly, these covers are actually very inexpensive, and you don't actually have to waste a lot of tape. So if anything, you're saving a lot of money on tape, just getting one of those shower covers. I do recommend getting one that's sized bigger, just because it may be hard to put on put the cast in the splint or the boot in a cast waterproof cover if that waterproof cover is too small. And you will most likely have a lot of swelling post-operatively, so that cast splint cover will actually be big Same thing with the boot. And so it made this actually hard to fit into smaller covers. So just make sure you're aware of that if you end up buying one. The fourth thing I'm going to mention, but I didn't actually buy, is a shower chair. A shower chair is very useful because if you're going to shower, you're not showering on one leg, lifting one leg up, and then trying to clean your entire body. It's not safe, and it doesn't really work. You're not going to be as clean as you want, but also it's just not going to be helpful for you because if you fall, more damage, more issues. So you want to have something that you can sit on to shower. A shower chair you can find on Amazon, different sites to help you in a shower situation. For me, I didn't end up buying a shower chair because I just ended up using an old plastic foldable chair that I had just sitting around in my wood shop. So this right there is something that I was able to use if I haven't purchased anything. The fifth and sixth items, 7 items, are really all mobility devices. So you're most likely to either be in a wheelchair getting you out of the outpatient surgical center, or you'll be in crutches. So realistically, you're going to be in crutches getting out of there. If it's more complex, you're most likely getting a wheelchair and they'll wheel you out, but you won't have any options with that. The crutches are extremely uncomfortable. The axillary crutches, they design them for a purpose, but at the same time, the armpit covers that are built into it are very stiff, not very comfortable. The hand holds are actually also stiff and usually uncomfortable. So what I ended up buying was covers for the armpits and the hands. Those you can find really inexpensively at Amazon or an online retailer. They'll help a lot with just feeling comfortable with mobility on the crutches. And the other thing I bought with that as well is I bought an extender for the tips of the crutches so that they were they had more friction on them so that they were a little bit more stable. They had a rubber grip so that they were less likely to slip. So it was a non-slip rubber end cap that I ended up buying for these actually crutches, and I'll show you in another video. Those helped a ton in terms of not sliding when I was using them. I also bought a knee scooter. Knee scooter is actually very useful. It'll help conserve a lot of energy on very flat surfaces. So I ended up buying a knee scooter. I bought hand pads, grips for the handlebars. I also bought a knee pad for the pad itself on the knee scooter to just add another layer of support and a little bit more comfort. Those aren't completely necessary to buy, but they can help improve your comfort if you end up getting a knee scooter. And the last thing I bought was this thing called an iWalk 3.0. I found out about this from patients a long time ago. It's been around for a bit, but this thing is kind of like more of it's a knee crutch. Long short, it's a knee crutch. You put it on your lower leg, it elevates your leg, and then you're really walking on your knee. So I'll show you that in a little bit too. But it itself allows you to move with the use of your knee as your extra support, and allows you to use your hands to do more tasks around the house and enabling you to do more tasks, but also giving you more independence. There's pros and cons of all these different assistive devices, and I'll kind of go over that in a different video, but they're all there to help support you in that post-operative care, and they allow you to do more after the surgery. So those are all the items I really bought in order to help improve my post-operative recovery and also mobility and safety. So this is kind of like my pre-op video, and I wanted to kind of go over all these different things to help describe the surgery, what to expect immediately post-op, and also kind of the equipment you may need, and just briefly talk about that it's important to do exercises to help improve your postoperative success. If you like anything that I said, please follow this video, like it, and subscribe to my channel. I'm going to include a lot more videos on different other aspects of my postoperative journey. And if you have any questions, feel free to mention them in the comments below. Hopefully this helped with your process and your preparation for surgery if you do end up opting for surgery. And thank you.